Hi, I'm Nurse Choma, founder of Choosing Nursing over at choosingnursing.net. And today I'm going to be talking with you about administering bronchodilators on the NCLEX exam. So to help you to visually, remember this information, I have in front of me a nebulizer set. So what I'm going to do, I'm going to go ahead and set it up right now so that way you can understand, how this is used, like what it matters, like what it means on the exam, and then it also help you clinically when you start working with patients. So let me go ahead and put it together right now. Here's how the set is put together. Now here's the thing I want to mention though. Typically in most hospital settings, you, the nurse, you're not really going to administer the treatment. Usually it's the respiratory therapist that administers the treatment. But however though, it's still good to know, right? So I'm going to go ahead and put this together like this. So this is going to go, let's see, right here, okay? And then this part's going to go, this piece right here, it's going to go in like so, okay? And like you will have to learn how to do some of this too, like I said, because for sure when you work clinically, you have to be able to figure out, if everything's connected right, if something is like malfunctioning, so that way you don't have to wait for the RT to show up. So I'm gonna go ahead and hook this here, okay? So see how it's like this? So let me just turn this a little bit like that. So on here is where my mouth would go, right? Or the patient's mouth would go. And then this part is gonna be hooked up to a nebulizer machine. So pretty much what a nebulizer machine is that there's medications that we give the patient, which are bronchodilators. But what this machine does is that it takes the liquid form of the medication and it makes it become like a mist. And so that's how it is distributed through here. So when this happens, usually you call this like a nebulizer machine or an aerosol machine. That's usually the names for it. And patients who usually have asthma, they're the #1 candidates who need to be on the nebulizer machine. So what I'm going to share with you right now is that there are 5 main precautions. All right, there's 5 main precautions, nursing precautions, that you should be aware of when it comes to patients who are taking this particular medication via this route or other types of bronchodilators. Number 1 is positioning. All right, positioning is very, very important because especially with patients who have respiratory problems, because it's going to promote the most amount of lung expansion. So before the patients receive this treatment, they have to be in at least a 45-degree angle as far as the head of the bed. So the head of the bed needs to be at least 45 degrees before you administer this drug to them. Then, and ideally, this is going to help the medication to pass through the lungs much more effectively, so they really experience the effect of the medication. So that's the first precaution. All right. Precaution number 2 is that you need to check their respiratory status prior to treatment. All right, prior to treatment. So before the patients you receive the medication, you need to get a baseline. All right. So here's one of the things about the exam. The exam doesn't just ask you as far as what to do about doing something. It's going to ask you questions about when to do that thing, right? When do you do that? But do you do that first or do you do that next? Do you do that after this or do you do that before this? What position should they be in when you do that? All that kind of stuff. So you do need to be aware of that. So before you give them this treatment, you need to assess their respiratory rate. You need to listen to their breath sounds because we want to see if it's going to be improved after giving this. You need to also check the peak flow if that was prescribed with the medication. And then you need to also, like I mentioned, be aware of the respiratory rate. So how many respirations per minute. So all those things need to be recorded prior to treatment. Now, so that was precaution number 2. Now, precaution number 3. So the third precaution, when you are administering bronchodilators that you should know for the exam, is correct administration. So what do I mean by that? Here's the thing. There is a correct way for patients to receive this medication. So one of the things that's important is that their lips need to be sealed around the mouthpiece. Okay, so like I would have this in my mouth, right? Right? And so literally I would have to have my mouth completely sealed around the mouthpiece in order for it to be given correctly. The whole time that they're receiving the medication. So here's the thing about the exam. The exam could pose a question, you know, where it could literally say the patient is, you walk into the room, you know, and you notice that your patient is on a nebulizer treatment and the RT has stepped out of the room. This is a very general question that you could see. And you notice that the RT has stepped out of the room and the patient is also on the phone talking while they're on the treatment. What do you do? Right? So at that point, that's when you would educate the patient and tell them, hey, you know what, you need to have this all around your mouth, right? Because it has to be sealed the entire time. So that's an example of a scenario where the exam could test you on your knowledge. All right, that's number 3, correct administration. Now, the fourth nursing precaution is that you need to monitor their heart rate prior, once again, before. All right, I'll talk about after, okay? So you need to monitor their heart rate before treatment. Now, the reason why you want to monitor their heart rate, especially if the medication they're receiving is a beta blocker, all right, is a beta blocker. So if it's a beta blocker, those medications tend to lower the heart rate. So once again, nursing is all about baseline. So you need to identify, you know, what is their heart rate, you know, prior to administering the treatment. So, all right, so that was number 4. So hopefully you're taking some notes. Now, number 5, what is the fifth? What do you think? Right, would be the 5th thing that we would want to tell the patient, right, after they have taken this. So now that they have taken the medication, right, they put it in their mouth, all right, like that, like literally all sealed and everything for the entire time period, okay? Now, after it's done, you want to tell the patient to rinse and spit, okay? So you want to encourage them to rinse their mouth with gargle it first with some warm water. All right, some warm water, and then spit out. Now, the reason why this is important, especially if the medication, because remember, the medication is passing. So literally, what you would see is that it would be like gas. Like it looks like it's gas. It's like a mist. Like they took albuterol, they took whatever the drug is, and they literally made it into a mist, and then it's like you're breathing in. Think about one thing that would help you. Think about like a cigarette, you know, or like smoking. You know, when somebody is smoking and they're breathing out that mist. Think about in the sense that this is a drug. You know, really it's a drug in a mist that they're inhaling. So that's literally what you would see that would be coming out on this side. So now here's a tip. On average, it takes about 8 to 15 minutes for them to complete the medication. All right, 8 to 15 minutes. You want to take note of that number as well. So you want to tell the patient to rinse their mouth and spit it out with warm water. The reason why is because if you don't, especially if the medication was a corticosteroid, they're at risk for developing an oral thrush with a specific bacteria called Candida albicans. So literally it will form like a white like a fungal infection in their mouth if they don't rinse and spit with warm water. So that's the reason why it's important to tell the patients to rinse their mouth and spit it out with warm water. All right, so those are the 5, main nursing precautions that you want to be aware of when it comes to the NCLEX exam. Now, I'm going to give you one more bonus tip. All right, one more bonus tip. And let's see if you already know what this is. Do you know the #1 side effect when administering these treatments? Well, it's going to be increased heart rate, right? Increased heart rate. That is the #1 side effect that can occur. And typically, it normally can occur within the first a couple of hours after they receive treatment. So you should anticipate, it's important to anticipate that their heart rate can be increased after treatment, which can be normal as long as they're not symptomatic. But however though, if the heart rate continues to prolong, like hours later, then there's a problem, and now you need to let the physician know and let the doctor know that the patient's heart rate, is still elevated. We need to do something about it. See the difference? This is what it means to know how to anticipate and really understand what's going on with the patient, and understand as far as the medications, how that affects the patient, and how you, the nurse, what you should do and do differently, and what you should be monitoring as the nurse. And this is how you would demonstrate competency on the exam for it to pass you. Okay?